We can go ahead and get started here if we have Cavalier County. And if anybody needs to go first or go early, like always, just let me know. Yeah, we can go ahead and get started.
Okay, are you seeing my presentation?
Yep.
So I am Steph Welsh with Cavalier County Health District. I'm in far northern North Dakota on the Canadian border. Our priority substance is adult binge drinking. We have a community norm of binge drinking and almost no events without alcohol, few restrictions. Ultimately, we'd like to reduce the social norm of binge drinking, but also do so by passing an RBS ordinance requiring RBS training for liquor licensure. We do tons of community messaging. We have movie trailers, print media, social media, billboards, local radio, which is wonderful, as well as we use brochures. In the last quarter, some of the high-risk binge drinking events that we focused media around were prom, graduation, Memorial Day, and the 4th of July. This is an example of our print newsletter, which we do email to elected officials, our coalition, and then we have printed and inserted in our weekly newspaper. If you look at the top, we've been trying to focus more on celebrating good behavior and the bars that are bars and off-sale establishments that are participating in RBS. But we feature alcohol-free events to change that norm of few events without alcohol. And that's the green sidebar on the second page of the newsletter. We are fortunate we get a boxed ad every week in our weekly newspaper as earned media. So we do called health tips. And so here are a couple of health tips, one around adult modeling and graduation, and another about binge drinking that we had in the last quarter. Earned radio, we get a 45-second earned radio spot that runs twice a day, and the message changes weekly. And this is an example of graduation and adults modeling responsible behavior that we did for radio. And that's the script, and we usually read it in our own voice, although sometimes we'll get a guest speak voice, such as local law enforcement or other coalition partners. This is our adult binge drinking social media messaging. Sometimes we create our own, sometimes we tag on other people's already created content and add a local message. Kind of a wide variety of adult binge drinking messaging in this slide of the things we did last quarter. We have an electronic billboard on Highway 5, which has a fairly broad reach. It's over 3,000 cars a day. Here are a couple of the electronic billboard messages that we have. A challenge with the billboard is, though, messages have to be really large font and very few letters of text. Parents lead social media. And again, we take usually what is already created content and add our own message. We have parent lead billboards throughout our community, and the examples here are the baseball diamond, an activity center, and a hockey arena, but we also have some at
I'm sorry, I'm just joined a Zoom call. I didn't hear what you just said.
These are examples of our parents lead billboards in our community. So for example, on here, this one is the far left is our American Legion baseball diamond, and it's a baseball image. The second one is at a local activity center, which is a gym, a workout gym, and then they also have a basketball gym. The third is at the billboard that we have at our hockey arena. We also have it in our high school gym. We have movie trailers. We have a local movie theater that has movie showings Friday through Monday, and we have a parents lead trailer that plays before all movies. We have a behavioral mental health task force. We do take the summer off. It's broad-based. This is kind of an overview of the people that attend those meetings. It's an all substance coalition, but certainly we can use it for alcohol prevention. And we've had good partnerships. We use the coalition partnerships to reach out to our local health system. We in the past have tried to convince or encourage them to adopt SUPTRS. With little success, they did a training and decided to opt out. So we're working towards that again. We've also used that partnership to solve some issues like where can we had an AA group that wanted to establish but didn't have a host. So we were able to find them a host. We identified the need for a local clinical licensed social worker that our health system adopted based on the feedback from that coalition. We partner with our local sheriff's department to offer RBS, and as I said, that's one of our main strategies is to work toward ordinance in that area. 15 of our 18 liquor licenses are current on RBS, which is great and at a voluntary rate. Of those 18, 2 are new licenses, so and not yet open. So we've been able to schedule yet just because they're not ready. They don't have all their staff. So truly, if you take those 2 out, it's 15 of 16 right now of operating establishments. We have some challenges, however, with implementing RBS. We've had 2 sheriffs in 1 year, which certainly is a capacity issue. We have 8 different licensing entities that we would have to go through to have it be consistent throughout our county. Some concerns about compliance monitoring. We have a new state's attorney that we need to build buy-in with. However, we have some real strengths and that high participation is one of them. And then we hear both from bar owner operators and law enforcement that they feel the in-person RBS is really valuable because it creates relationships. And it's so not just for RBS, but for other needs, and that if allows bar owner operators and bartenders to ask questions. Is this right? Did I do this right? Is this what I should have done? But it also creates relationships where they're comfortable calling on each other for mutual aid. We did have an issue where we had strong support in the Langdon City Commission, went to them with RBS ordinance they were going to pass, and then they, while working on drafting, backed out unexpectedly. So we're at a point where we're trying to decide whether we want to double back with that city commission or move on to a different elected body. A potential opportunity is that in the current election for our Cavalier County Commission, the previous sheriff, one of the 2 in the last year, is running, and he was a champion for RBS. So possibly looking at the feasibility of waiting till after that election and moving forward with a different body, elected body. Another thing, few events without alcohol, a different strategy that we're working towards. We've been partnering with the Langdon Chamber of Commerce to add and maintain alcohol policy at Music Fest. It's our biggest outdoor street dance type event. We went in the lifespan of this grant work, went from having an event with no restrictions at all. You could bring outside alcohol, you could have open container, there was no wristbanding, there's no beer gardens, to having ID scanning, wristbanding, clear cups only, no outside alcohol. And now this year, for the first year, we worked with our sheriff and our Eagles Auxiliary to get a permit for a beer garden. We're hoping that that's successful, does well, and will continue to be a growing strategy at events in order to separate alcohol use from areas of the event that don't have alcohol use. Opportunities and successes we've had in the last quarter. The high RBS voluntary participation rate is great. We're really, really pleased. Of the 2 entities that are soon opening, 1 is already committed to do RBS, so also good. We have a lot of earned and paid media opportunities locally. We also were fortunate that this semester we have an NDSU Masters of Public Health practicum student, and they're going to work on an RBS project for us, including litter.
Did Steph freeze for everyone else?
Pardon?
Oh, there we go.
There you go.
It froze for us for a minute there.
Oh, shoot. What's the last thing?
Oh, you're freezing again.
Oh.
There we go. The last thing we heard you say was about your grad student practicum, I think was the word. So
Yes, we have an NDSU Masters of Public Health student that's working on a practicum in order to do a lit review of existing RBS data on benefits, those kinds of benefits to the community. He'll do some original data collection with our stakeholders around RBS and then create some infographics or fact sheets that we can use with elected officials. And I think that's my whole presentation.
Hey, I had a question for you, Steph. Just,
Yeah.
you know, you said that it's been a decade since you've had a beer garden. What were they doing before a beer garden? Was it just free for all, just retailers selling?
Yeah, so yeah, for this event, it is held on our main street. We kind of have, it's almost a triangle of liquor establishments on our main street. In the center is where the event is held. On the street, there's a little community square. And for that event, there just was nothing. So you could go into a bar, buy a drink, walk out on the street with it, go back in with it. There was an issue with you could bring in outside alcohol, so people had coolers in their trunks and were having drinks in like Stanley cups or whatever the equivalent 10 years ago was. Just no kind of structure at all.
Gotcha.
In the
Okay.
way back, like probably 15 plus years ago, we had beer gardens, and I don't know why it ever ended.
Okay. Well, let us know how that goes.
Mm-hmm. I'm very hopeful. Fingers crossed that it'll be successful and they'll just like do really, really well and everybody will want it because it was financially beneficial.
Yeah. Good.
Awesome. Thank you, Steph. All right. Next up is Central Valley.
Suppose it might be a good idea to turn my volume on. Okay. Here we go. My name is Shannon. I am with Central Valley Health based out of Jamestown. We cover both Stutzman and Logan counties. Our problem is underage drinking that we are focusing on with the SUPTRS grant. We are focusing on retail access and social access, including working with the bars for ID scanning and that type of thing for retail, as well as a few things with our social access that I'll talk about here. Just a few of our highlights from the last quarter that I wanted to talk about is that we had partnered with our local soccer booster for our high school girls soccer team and did a sticker shock campaign with them out of their concession stands at the soccer fields, which is something we've never done in the past. And we did about 300 stickers on popcorn bags. So that was really fun. They also handed out parents' lead materials. Another thing that we've done in the last quarter is work with a few bars, including the Woolly Bar and Spirits Bar and Grill, which is two brand new bars in the community. So they're kind of hot spots for people wanting to go because they're new, hot, fun places to be. And so we have forensic ID scanners at both of those establishments, and we've gone with them to do some training on using the devices. And then we also had a forensic ID scanner at our county fair this year in the beer garden. A new development is that we're working on meeting with rural schools to discuss implementing an evidence-based campaign, and we've decided to go with the Keeping It Real campaign. So we're excited to work with our rural schools out in the counties to implement that. And then lastly is just social media, prevention messaging, parents lead implementation, and offering those resources in our community, including the most recent was Kids Safety Day. We gave parents lead materials out to the 300 kids that attended the event. And that's all I have, short and sweet.
Awesome. Thank you, Shannon. All right, and then I have city counties here that I'll share for them.
Yes, thank you, Callie.
You're welcome. And I appreciate you giving me a heads up so I could pull it up ahead of time and it not take forever. Because I don't know, for some reason my computer does not like PowerPoint and it takes like 5 minutes to load in a slideshow.
Absolutely.
So.
No, that's perfect.
All right, there you go.
Thank you. Thank you. All right. Yes. So I'm Megan. I'm with City County Health. Next slide, please. We are focusing on underage drinking the age 18 to 20. Next slide, please. Our intervening variable will be the retail accessibility, and our local condition is underage people are able to go into any retail access point for alcohol, and most of the time they're not even getting ID'd, they're just able to buy alcohol. And then also I've had some instances for compliance checks. People did get their ID checked and they still were served. So our strategic plan would be to, we have already implemented the compliance checks, and then also making sure that we have forensic ID scanners at community events. Next slide, please. So our activities that we are focusing on, like I said, I was able to recruit minors with the police department, doing those compliance checks. And then with the goal in the end of this 3-year grant block is to be able to have everybody in our area passing their compliance checks. And then another little sub goal that we are working on is offering the forensic ID scanners at community events. Next slide, please. So like I said, we're going to do another round of compliance checks in September. The 12 bars in retail establishments had failed. And with those, I was able to send out congrats letters with like a little reward to the people who did pass and congratulating them. But then I also touched base with the people who did fail, letting them know, that our police department does offer in-person RBST training, training. And then also, I have access to the forensic ID scanners if they want to be able to like go in with me to implement those in their bars. And then whatever training that I can connect them to or just be available to help them with. And I've had a really great response with that, especially with the RBS training. Everybody is really, we check it quarterly in our county. If you hold a liquor license and you have someone working, you have to turn your stats in quarterly to say what servers are trained on that, which is nice to keep things up to date. And then, like I had mentioned with the forensic ID scanner, something we're working on now, we do have 3 available in our community. And so we want to be able to offer those when a bar applies for a temporary liquor license. It's also offered for them that City County Health will pay for a cop to be able to be at that community event with the 3 forensic ID scanners. And that's about $55 an hour for a cop to be there. So being able to show that these forensic ID scanners are present with the cop there as well is something that we're wanting to implement. I want to collect good data on it so that I can go to my city commissioners and try and get it passed that when you do apply for a temporary liquor license in the future, it will automatically be in the price that you will have a cop present as well, and you will have at least 2 of the forensic ID scanners present doing the scanning. So yeah, that's my goal in the future. We already did one community event. We had a street dance a couple weeks ago. I was able to scan IDs with the police department, and it was pretty successful. We didn't catch any fakes, but the scanners did a great job, and it was just great for the community to be able to see that. Next slide, please. And then we also are just making sure that we do parents lead material as much as possible. I table a lot at different community events with parents lead, having the playing cards present in our waiting area, resharing on social media. And then we have a lot of banners present throughout the community at like baseball diamonds and in the school gyms and everything. So lots of good things there. So yeah, that's about it though. Thank you so much.
Hey, Megan, I have a question. Did the
Yep.
community respond to the 12 of 16 failing compliance checks?
Okay, so listen, my police department has not put out the press release yet. Like we've been working on it, but they just like we made it, but they didn't put it out yet.
Okay. Yeah,
So
no
yes.
worries. I just was wondering.
Yeah, no. And let me tell you, the bars responded, that's for sure. Everybody wanted to sue the police department. It was just a great old time. But also like they also came to us saying like, it's on my camera that you said that we served this person at 8:20 and it says on my camera that it was 9 p.m. And my city commission was like, you literally are telling me you have on camera that your bartender served a minor. And they were like, well, it was at the wrong time that it was charted. And like, that's not how
Yeah.
it works, kind person. So
Oh, wow. That's
Yeah.
wild.
it's let me tell you, Valley City is wild. And at these community events that we have, it's not just one bar wanting a temporary liquor license, it's 3 bars at like a simple street dance. So I don't know. So I'm so happy I have such a proactive police department though, and they really are pushing to like any activity I bring up, they're like, yes, let's do it. So it's really great. So
That's unbelievable. Well, we have some toolkits online. I think we sent them to you before, but they have some really good talking points, and they even have draft press releaes. So if you haven't checked those out, check them out.
Yes,
But
yep. Yeah. Like I said, my chief police he's really great about that. And yeah, he's new too. He just came on job in January. So
oh geez, break them in early.
Yeah, I'm just really breaking him in, I tell you what.
Well, good deal.
Thank you.
All right, next up is Dickey County. We have anyone from Dickey County on? Oh, microphone isn't working. Okay, we'll circle back to Disney. Wow. Good morning. Dickey County towards the end, or you can let me know in the chat when you figure out if your microphone's working, Abby. Okay, so then we have, oh my gosh, I lost my list. I have way too many documents open on my computer. Okay, Fargo.
Okay, let me pull up here. Sorry, I'm just trying to pull up my presentation here.
You're good, no worries.
Okay. All right, so I'm Robin with FargoCast Public Health. Our local condition is, our area focuses underage drinking. Our intervening variable is high retail access, and our local condition is high fake ID use. So some of the activities that I'll be highlighting over the last quarter is our Child Care Center partnership, our Parents Lead Resource Corners, our tabling events, our Prevention Week event, our Alcohol Compliance Check news releases, our stakeholder meetings, and our scanner use and placement. So for our Child Care Center partnership, we have a local ordinance that requires child care centers to have physical activity. And as part of that ordinance, we provide training as well as inspections at the child care center for compliance with that ordinance. So along with that, whenever we do the inspections or have training events, our staff provide parents lead materials. So over the last quarter, we had 8 child care centers inspected and there were 750 materials distributed. We also had 1 Child Care Center staff training and 251 materials were distributed. We have Parents Lead Resource Corners in our public health clinic and our WIC waiting rooms. So in each of those waiting rooms, we have a literature rack with brochures, flyers, and activity books. We also have a magnetic chalkboard for our Parents Lead magnets, as well as a folder holder that has the playing cards in them for people to take. Our tabling events, we had several this last quarter. We were at the Suicide Prevention Summit. We were at Soul Shop, which was a suicide prevention summit for clergy. We were at the Stepping Up for Children walk. We had a FargoCast Public Health Spring Social, as well as the ACT Community Theater Mental Health event. This is a picture of our table at the FargoCast Public Health Spring Social. This is a look at our Facebook post for the Spring Social. We also had an open house education event at the West Fargo Fire Department on May 14th for Prevention Week. We had a lot of different resources there, obviously including Parents Lead resources. We sent news releases for alcohol compliance checks to announce those that failed. Not only were the news releases sent, but they are also posted on Facebook, Twitter, and the website. This is a look at the website post. We had stakeholder meetings, and those meetings included a presentation to our Board of Health. That led to a meeting with West Fargo Police Department. They subsequently committed to help implement 7 ID scanners in West Fargo. ID scanners were in use at 3 Fargo locations over the last quarter, with 1 additional ID scanner being implemented this quarter. And hopefully we'll have a lot more. Well, actually, we already have had a lot more activity this quarter with ID scanner placement. Actually, we placed just 3 yesterday. So that'll be my next update. And there's my contact information if anyone has any questions or wants to reach out. Thank you.
Perfect. Thank you, Robin. All right. First District is up next.
Callie, I'm sorry. I assumed I was on second day.
Oh, shoot. Sorry. That's okay.
I must have been looking at last time's list, and I know we were like at the very bottom, so I just assumed we were on day 2. Can we go tomorrow?
Sure. Yeah, that's fine. We can move you to tomorrow. No problem.
Okay.
Okay, so then Grand Forks.
Good morning. I'm here. Can you hear me?
Yes.
Okay, good. Just 1 second. All right. So can you see my slide?
No.
Okay.
Let's see.
Of course not.
That's okay. And I can always try to pull it up too if you have.
No, let me try this again.
Yeah, it doesn't look like it's sharing
Hit
anything.
share.
So. There we go.
Okay, good. All right. All right, I will keep this fairly brief. So reporting in from Grand Forks, this is Misty. With Altru, we collaborate with the Grand Forks Public Health. So ours is social availability and community norms with kind of the target of like that information dissemination to really just enhance kind of parental and community protective factors. Grades 9 through 12, it's just very much a social thing in our community of it's okay to give kids their alcohol. So we work really closely with Anchor Marketing for a huge marketing and media campaign. All of our monthly things that we do, the Spotify, the iHeart, Grand Forks Public Schools, newsletters, the Facebook page. We're working on the movie theater preview ad things. All of those are different every month. So each one of those is a different messaging that is parents lead and prevention oriented. So like an example, then our Grand Forks Public School, the newsletter that goes out, it has a reach of over 4,000 people every month. So that is a target to the parents and the teachers and the staff at the school. So really just in catching all of those that are the grade associated with the grades 9 through 12. SAPC collaborations, we collaborate very tightly with the Substance Abuse Prevention Coalition. Both myself and then Haley from Grand Forks Public Health are part of our sit on the coalition. And so I totally forgot when I was doing my monthly reporting way back last spring that we did a separate meeting with a small group of us that went through the drug-free communities sponsors / through the SAPC, the youth survey that is related to alcohol, tobacco, and marijuana use in those grades. And so a small group of us got together and went through all of the questions that we wanted to ask. So I just checked in actually just this morning, it popped in my head. And they have not gotten the results back yet. So waiting on the results from those to see from the last 5 years on how things have changed across our community. Again, the Grand Forks Public Schools, they are the fiscal host for the DFC. So we collaborate really tightly on all things that have to do with the schools. Blue zones, Grand Forks is the only community in the state that's a blue zone community. And so we work with that group. Their target is bringing like health and wellness to the community and to businesses. So I've already had conversations with the lead for Blue Zones. Their focus for next year is having the high schools become Blue Zone certified. So bringing health and wellness things into the schools specifically. So we'll be working with them this fall on some fun projects. I don't have a lot to do myself with this role in this grant with the Grand Forks Police Department, but Haley does. And so we connect a little bit on that, especially through the SAPC giving updates and stuff like that. But since that's more the Bake ID focus, and that's not necessarily this focus, I say connected to it, but not necessarily overly involved. And then we do some tabling. We have some tabling events coming up this summer. A big one for us both SAPC is SAPC is both us and the SAPC are having kind of some staffing things going on. So they are missing a project director. So connecting on some of those community events where one or the other would be the one sitting and tabling has been really tricky this last quarter. So hoping to really make that effort this summer now when we've got some more community events coming up in August. But a big one for us was the Live Grand Health and Wellness Expo that's held at the LaGrave. It's Grand Forks' permanent supportive housing development. So really targeting that homelessness, disabilities, low income, mental health, trauma, that at-risk population. Addiction is a very big one in that community. And so I connected with the director of the LaGrave, and we had some parents lead materials, coloring pages, and some materials right at their welcome table. So that was kind of exciting to partner with them. So looking forward to some more of those like in person. Also the director of LaGrave, Corrine, she is going to be assisting on some of that in person in Grand Forks tabling events. She did just complete the core competencies for prevention work training. So she's going to be kind of doing a little bit of this in-person stuff in Grand Forks also. So that's all I have.
Awesome. Thank you, Misty. Okay, then it's Lake Region. We have anybody on from Lake Region?
Yeah, we're here trying to get it up.
Hey, Kelly, can you pull ours up?
Sure. All right,
Sorry,
give me
I
just a
thought we
minute.
knew what we were doing. Is it could you do it now? Oh,
I will pull it up here. It'll just take a minute.
do you want me to just start talking?
If you want, I'll pull it
Okay.
up as soon as I get it pulled
Yeah,
up.
no, I'll just start talking. I have way too much time to do Canva right now. So anyway,
I
Lake
love
Region
Canva.
District
Canva's
Health.
a great tool.
We're in 4 counties: Pierce, Benson, Ramsey, and Eddy. Of course, my focus a lot during the school year is schools and younger. So I was thinking about the wonders of prevention and keeping my own excitement over the summer, because we kind of shift a little bit. But we're going to give an update on what we're doing this summer and explore the exciting things that happen during this time of year. We ended with a school carnival, the school year with the school carnival. The schools are reaching out to us to become involved, so that's really exciting for us. And we're sending our kids out into the summer knowing that some kids have a lot of things to be involved in, and some kiddos, it becomes a risk factor because they have more time. So my thought was to wrap some protective factors around our uptown community and the kids that maybe had to go to summer school. And so that's kind of led our summer prevention. I should say that our goal is, or our problem is underage drinking. And so very much similar to what other counties have. But I have a slide in here on the SUPTRS training that I went to. I was very excited. And now I'm starting to think of all these problems in our world with the SUPTRS model. So I'm very excited about that. We did do congratulation graduate things for congratulating our graduates on their dedication to being drug and alcohol free. So we made posts for each school and sent them to the school's web, pages, and shared them throughout our community. We also attended motivational interviewing conference in Fargo, and that was through our tobacco grant, but realizing that the motivational interviewing conference is very much wrapped around all substance use. So this summer we had board game. We called it Board Game Blowout, and we partnered with businesses in Devil's Lake, and we had an event for families and kids to bring their kids to play board games. And our partners provided beverages and snacks for that event. We have another one coming up next week. And I have some pictures on here of our board night. Game night. We had 18 people come, family, grandmas, parents, and kiddos. And our ID scanner work continues, and Lori is working her magic in.
All right, I finally got it pulled up
Yeah,
for
just
you.
screen through there and I'll tell you where to stop.
Okay.
That was our.
There's
Yep.
the SUPTRS training.
Yep. Those are all of our congratulations to the graduates.
Perfect.
Ones. And motivational interviewing.
There's the board game slide.
Yep.
Okay, here we go. Game
Yep.
night.
Game night. So we had kids from summer school and families come, and hopefully spread the word will spread, and this will be something that we continue doing. The kids had a great time. And then we are on to the next one, the ID scanner work.
Okay.
Yep, that's where we're at. So Lori is here working her magic with customer service. We had an establishment that we needed to do some updates. So we spent a whole afternoon doing updates and communicating with a few of we have 4 scanners out right now and 2 more ready to go out. And okay, you can go on to the next one.
Oops, there we go.
Responsible beverage server training. We had one signed up to come, and then I went out the week before and took just made sure checking our mailing addresses, because we have 2 of our establishments here that haven't sent anyone in quite some time. So I decided to go personally and visit them. And some of the information, the next slide, we heard some exciting things from our establishments. Black Paws is a new brewing establishment in town, and what they shared is that they are identifying designated drivers at tables, and then whoever's the designated driver is, they're giving them a free root beer float to acknowledge that safe behavior. So and they did that on their own. So that was exciting to hear that they're helping. And then the next slide is one establishment that we have 2 scanners at, and they are also this is a Facebook post that they are having liquor replacements. So they're doing beverages that are no alcohol, mocktails, and advertising those. And then our promotion was ND tips. We're trying to get that out into our community, and Lori has done a fabulous job with that in getting our police department to dispatch the tips out for the 4 counties. So this was on our access channel, and the 4th of July was our promotion we did, and we handed out little business cards. They were hooked onto ducks, and we threw them out from our parade. The next one is a picture of our parade. And my family was, and you can keep, there's the next one. My family was involved with this, and they said they want to do this every year. They are so excited. And then we took, after that, we took this to the park. They loved it. And then we put this out at the park afterwards, and I handed out ND tip cards and asked community to just, partner with us in reporting unsafe, or anything suspicious and underage drinking. And the next ones are just self-care. I got looking into Mother Teresa. I just thought they were all good. Don't worry about numbers, help one person at a time, and I will start with the person nearest you. Anyways, look these up. Were great encouragement to me, and I wanted you to know that to take care of yourself was my passion too in this role. That's it. Thanks, guys.
Awesome. Thank you, Cindy and Lori. Okay, and then I will jump right into, I've already got the PowerPoint pulled up for Lemoore. So we don't have to wait for my dinosaur computer.
Mine is very drab after that great presentation.
No, these look great. You guys put a lot of effort into these, so I appreciate that.
All right, underage drinking is our area of focus. Yeah, if you wouldn't mind clicking for me, Callie.
Yes, sorry.
Thank you. And next slide are intervening variables. Youth can easily obtain alcohol from friends and family. Unsecure places like the lake and at home. Lemoore County has a population of 4,113 establishments that serve alcohol. That's 1 alcohol establishment for every 315 people. Local conditions, youth can easily obtain alcohol from friends and family. 7 alcohol-related sports activity suspensions in schools. Lemoore County Sheriff's Department reported 21 individuals under the age of 21 who were given community service, and 7 of those were under 18. So some of the things that I have been working on is parents lead banners at 2 of our baseball fields. Let's see, I have social host information on the baseball programs.
Oh, sorry.
Have
I'm
done
on the
above
wrong
the
side.
influence. Yep, go ahead, go to the next one.
This one? Okay.
Above the influence yearbook ads in Cullum and Lemoore schools. We did offer them to our other 2 schools and did not hear anything back. Post prom information to 4 of our schools. I have extra fake ID scanners out, and we will be implementing some of them at some of our street fairs that we have coming up, or not, excuse me, not street fairs, street dances that we're having in the communities this summer. Lemoore is also, I sent out daycare bags to all Lemoore County daycares with emphasis on positive role modeling, and we did a lot of parents lead information out for that. There is our, we did a fake ID scanner training with special speaker Tom Vogue, and guess what? I didn't get any pictures. Can you tell I'm a rookie? Parents lead banners at our baseball fields, so we do have those up. Lemoore is hosting the state Legion tournament, and I'd like to throw out a quick question to everybody. We are doing bags up for all of the teams that are coming to town, and we will have various information in them. Does anybody have any ideas for us? I mean, we have the bags secured. We have different like different brochures that we could hand out, just looking for some ideas. We don't host until August 2nd through the 6th, but looking for some ideas. And next slide is toward the end. I'm really good about doing things and getting out in the public and sending stuff out. My biggest thing is taking time to gather data. Our people have had a lot of trouble with the ID scanners, and mostly because it's the updating that takes the time. And sometimes I need to bring the scanners back here and call tech support. And I don't know if it's because of our scanners, or some of our scanners are getting older, but some of the things I need to do is work on gathering data and taking time to do that. So that is about it for what I have today.
Well, I'm glad you didn't get any pictures because the camera adds about 100 pounds on me. So, yep. But no, if you have issues with the data collection, you can do that quarterly or even like on an annual basis if need be. We just need some data.
Right.
So,
I need to, I'm sure I can do it quarterly. I just need to take time to do it. I'm a doer, and when it takes time to collecting data, I need to work on that part of it. So that's on me, but I'm working on it.
Yeah, and an easy way to do it that I've heard others do is they have hotspot on their phone, so that they have that, and then they link the scanner to their phone, so they don't have to worry about connecting it to the Wi-Fi in the establishment. If it's not, this is if it's not connected, and then it remembers that Wi-Fi connection. So when you walk in, you can connect it right away. You can download the data and then send it to your email right away. It makes it a little bit easier if they're not connected to Wi-Fi through the
Boy,
business.
if there's anybody out there that would be able to come and show me how to do that, I am so terrible with support. I can go in there and I can pull up the data on the screen, but getting it sent to myself, I don't know how to do that when I don't know how to get email service at the place where I'm at to send to myself.
Okay, I'll make a
That makes
couple short
sense?
videos. Yep, I'll make a couple
I was
short
gonna
videos.
say
just
that
to
would
do
be
a quick
something
one.
we
Yep.
could do. We could do maybe even tomorrow or tonight when we're with First District, is just make a quick little video on our phone just to show you how to do that and send it to you.
Okay. I think
Um,
there is a video out there and I watched it, but sending it to an email from a business, when I'm in the business collecting that ID scanner, and this is something we should be taking time out on the side than taking everybody's time. I'm sorry about that. So yeah,
Fine.
we'll get it figured out. So thank
Okay.
you.
Yep, for sure.
And also,
No
if anybody
problem.
has any ideas for state baseball, shoot them my way. Thank you.
I do have one quick question though, and I'll be super quick. You mentioned the community service for the underage drinking. Do you happen to know if that was the only thing that those youth were required to do, or if they also had them do any sort of like early intervention education, like an MIP class or anything like that, or if the judges in these cases were kind of defaulting more towards community service versus that education piece. I'm just curious, since I do the early intervention, I'm curious to know if that is maybe a direction that is being shifted with some judges, just out of curiosity. So
I can find out for you and
sure.
and see where that's at.
Okay, cool. Thank you.
All right, thanks.
Okay, Nelson Griggs is up next.
Okay, hopefully that pulled up my screen, did it?
Yes, we can see it.
Okay, perfect. So it's Cassandra. I'm with Nelson Griggs District Health Unit. Our focus is youth underage drinking and high retail and social access. So we're focusing on fake IDs and also changing consequences for like those youth that are caught, maybe making some more consequences for them and some more education for them. There we go. Currently, we're doing a lot of information dissemination. Our communities, as probably everybody heard with Griggs County and their community event, how against policing they were. So I feel like a lot of education is still needed in Nelson Griggs. So we're doing that through posters, flyers, newspaper ads, social media posts, brochures, newsletters, popcorn stickers. We're still enhancing our skills. Lisa and I are still, I'm gonna say new. Tom said I can use that for 10 years. So we're only like 3 years in. So we're still learning, doing those trainings. Like I said, we do have one fake ID scanner within establishment. It's working pretty well. Lisa's kind of working on that and getting all the kinks out. We're hoping to get a few more involved with that, maybe adding some fake ID scanners to different communities. Also thanks to Lake Region for the ND tip. So Nelson is a part of that, but Griggs County, being as they've changed sheriffs, I think probably 4 or 5 times since I've been here, we're still getting them kind of on board with their part. Finishing up, we did those hidden in plain sight events at all of the parent teacher conferences. We also did the after prom parties in 3 of our schools. Next steps, again, we're just trying to get into those schools and maybe changing consequences within the schools, giving them some more education, also changing physical designs or environment. So hoping to be more involved with those sheriffs when those community events happen. Hopefully doing more pre-work when those community events happen. Also working on a regional event so that we're going to work on brain changes that happen. And I think that'll really be good education for me because I think I need more education on it so that I can educate our constituents better on brain changes that happen because we find a lot of our community members are giving their kids the alcohol so they know what it feels like when they go off to college. So I think if I am more educated on it, I think I'll be better education for those parents that are thinking that. So I think that regional event will be really good for us. And then just thinking back to our last meeting about finding our opinion leaders and really getting them on board. So I think we can do some more work with that. And like I've said throughout the whole thing, our community just doesn't see it as a problem. So, and that's all I have.
Perfect. Thanks, Cassandra. All right, Pembina County.
Okay, I'm here. Can you see it?
Yep.
Okay, so April through June, this is Rochelle from Pembina County, and we're just up in that northeastern corner. We are priority substances underage drinking, with the intervening variable being high social access, community norms, and low community readiness. Interaction surveys suggest that alcohol is readily accessible in homes for youth to take if they want.
And then they're exposed to alcohol frequently, which creates a perception that alcohol is normal, accepted, and fun. So activities we've been doing, providing information, parents lead, sticker shocks, webinars, trainings, trying to increase awareness with posters, social media, newsletters, newspapers, reviewing current laws, assess the current process within law enforcement and court, determine where enhancements can be made, and then partnering with school groups and local organizations to support alcohol-free events. So April was prom month. We did support Drayton after prom, and this is what they sent us, a thank you. And then we put some posts on Facebook. Also trying to remember to post ND tip things. We also had the teen maze that we were planning on April 18th. That was good. It was 130 Pembina County 7th and 9th graders. We had CVIC from Grand Forks come up and do a healthy relationships presentation. And just putting parents lead information in our summer newsletter and on our Facebooks. Graduations in May, we did a graduation post. May also did the SAPS training. June, we did the coasters with parents lead. Picture on it, brought them to Pembina County restaurants. And then, of course, the parents lead on Facebook, and then promoting the 988 post on Behavioral Health Division. And that's it.
Yeah, Sarah said in the comments, love those coasters. Those coasters looked great.
Yeah, they were cute. They
Awesome.
turned out well.
Perfect. All right, next up we have Ransom County.
Hello, just getting my stuff set up here.
While you're doing that, Chris asked, where did you order the coasters from?
Vistaprint.
Vistaprint. Okay. Vistaprint is actually really good they're pretty budget friendly for getting some stuff like that. Like printed
Yeah, and
materials.
they have good customer service too. I feel like they respond very quickly if you have an issue. And
Awesome.
Can you see my screen okay?
Yes, thanks, Kayla.
Okay. So I'm Kayla from Ransom County. Our focus areas, underage drinking, our intervening variables are high social access and community norms. Local conditions, our youth are obtaining alcohol from their friends who are of age. Parents find underage drinking to be acceptable. I would even say I could have added this on here too. Just recently, I've been getting a lot of word of parties being had at lakes, family lakes, and the parents are there and they're actually inviting a lot of high school students and friends there. So when Nelson Griggs was talking a little bit about the getting kiddos ready so they know what it feels like when they go to college, it is definitely hot and heavy currently in Ransom County. So I'm finding that pretty interesting, especially when the sheriff's department haven't been receiving calls about this or seeing any of that nature. So activities, what we've done so far, we do a lot of stuff in the schools. So one of our big things we do is we collaborate on our immediate efforts with the Southeast region counties for a unified message. I attended the SAPS training. Like I mentioned, we do a lot of the outreach with the sheriff's departments, and ARN is a huge partner with us too. The ARN stands for Abuse Resource Network. So we have been doing a lot of activities with them, just trying to get our names out there and how we can help them provide services to our area. We have been able to do the identified ID scanners. We got that free scanners in some facilities down here. It has been going really well.
I just actually went and touched base with another one yesterday to do some updates on it, and hopefully that will help some of the kinks that they're noticing when they scan some IDs. I attended a health board meeting to give them an update on our prevention efforts for Ransom County. I attend a lot of the COP committee meetings, the growth partner meetings, just like everyone else in the trainings that are being provided to us. We are currently planning our regional events for Region 8. In school, when school was going on, we were able to partner with some local businesses. This was kind of a fun one where we collaborated with Earth Day, and with that, one of our hopes was getting a lot of like the litter that was found and then talking with classrooms on it. And so there was actually, it was pretty cool. A lot of the teachers in the middle school as well as the elementary school, they partnered with us, and we kind of went with them and we took pictures and we talked about a lot of the trash that they found. So that was really eye-opening to them, especially when they were walking through the park area and they were like, why would people do this? You know, kind of a thing. We did that. We also made a visit to a daycare and a bank, and we brought some parenting items to them as well. And we talked about self-care and how we cope with stressors and things like that. Another big event that we partnered with ARN on was the Meet the Farmers event. It really took off in our area. We went and visited with farmers at their farm, fields, shops, kind of wherever they were at. We just discussed some things, you know, in their high stress moment of planting season, and what are some ways that we can help provide resources to them as well as their self-care during that high stress time. During Happy Days, that was a really big event that we do in the summer in Ransom County or in Lisbon. We had an open house here at Ransom County Public Health. So I provided a lot of parents information there. Just kind of with the other ones too, like SOAR. We did some stuff with SOAR, so like the Deterra bags. We provided 988 information as well. And then we also had a wellness clinic. Our wellness clinic was a really big hit too. Unfortunately, we had a really long wait. So we're going to work out our kinks hopefully for next year on that. But in that wellness thing, we found a packet from SAMHSA that was super informative. And we actually got some feedback, and one was a thank you card that someone sent us, and it was in regards to that SAMHSA packet. That SAMHSA packet really went deep, and it talked about a lot of different things in there. So if no one has seen that packet, I would highly recommend that. Look up that SAMHSA wellness packet.
Would you be able to send us that so we can put it on the grantee portal page, just in case I don't already have it up there? If you could just email that and I can get that out to everyone.
Absolutely. I didn't even know it was out there. We just really stumbled upon it when we went to the SAMHSA website.
Sure.
And then the last thing is our media efforts. We still continue to share a lot of our stuff on our Facebook business page. So parents information, the 988 speak volume, things like that as well.
Awesome. Kayla, can you talk just real quick about I'm curious to know how that Meet the Farmers event went. Like, were they pretty receptive to that? Because I feel like that's a tough demographic to kind of get through, especially when you start talking about things like mental health and self-care, that's maybe a tougher group of people. So how did that go?
Absolutely. I think since we were meeting them face to face, they were very more open about it. I think if it was like a phone call or just, if they don't know us, I think it helps too that we have been really working on self-care and mental health and raising awareness on that for quite some time. And this was the second time that ARN did this event. I think that also bridged that barrier. But for the most part, everyone was super appreciative. They really enjoyed the information. And a lot of them were saying like, you are right. I do need to do something like, during planting season, especially during spring and harvest are their two high stressful times. And so I think they were very open, the ones that I talked to. We had 80, I can't remember exactly, we had like 85 or 86, individuals that we met with. And
Oh,
so,
wow.
yeah, it was a really big turnout. And then we also had some other businesses reach out to us and ask if they can help us too.
Awesome. Thank you, Kayla. Okay, and then I have Richlands pulled up here.
Perfect. Can everybody hear me?
Yes.
Yes, perfect. Okay. Hello, I'm Amanda. I'm the Director of Nursing with Richland County and currently floating the SUPTRS grant until we rehire for the position, as Lindsay is no longer with us, unfortunately. So we can head on to the next slide, Callie. Our area of focus for this project is underage binge drinking among residents 18 to 20 years of age. We have a high incidence of young adults who are binge drinking, in part due to our science school here in the community, which houses 3,000 students. Some intervening variables: increased access to alcohol. Richland County has 42 establishments where alcohol can be served or purchased. Increased promotion of alcohol at community events, similar to other communities. Community events are often centered around alcohol to gain attendance, and then lack of enforcement. Bars admit that they don't always call law enforcement when a fake ID is identified, and in some cases will give the ID back to the individual. We look at local conditions. Wahpeton Police Department has issued 14 illegal consumption citations in 2024 and identified 13 minors in Wahpeton bar establishments. In 2023, among those 18 to 20 years of age, the clerk of courts reported 23 minor consumption citations and 7 driving under the influence arrest. And then in 2023, our science school, or NDSCS, had 218 on-campus alcohol violations. Regarding our environmental strategy, the RBST ordinance, we do currently have officers trained to do the responsible beverage server training, but from my understanding, it's not consistent as far as how often it occurs. So we're working on a ordinance with the city of Wahpeton that would require employees to take the classes within 3 months of employment, where alcohol is either served or sold. And then prior to Lindsay's departure, she started working with our science school on a social host policy, and looking at some consequences for renters on campus when alcohol is present. Activities. So Lindsay did a lot of great work prior to her departure, so I'm likely not capturing everything she did this quarter. But we disseminated some parent need information throughout the community, examples of where this was disseminated. We hosted a community event targeting vaping in April, and at that event, we provided flyers to attendees discussing communicating with their children when substance use is expected. We've done some social media posts during prom and graduation, discuss responsible decision-making during those high-risk times, in addition to a post discussing parents' influence on their children's behaviors. And then we had a Parents Lead banner displayed at our community event and during the Wahpeton High School graduation, specifically the Influence Them Before Alcohol Does banner. And then we've been placing those cards in our health department and social services waiting area. They'll use utilizing our digital media campaign, so we're continuing to work with a local company on a monthly digital marketing campaign. We fortunately have one digital billboard in Wahpeton. So during Alcohol Awareness Month in April, we did some messaging surrounding the importance of not providing alcohol to minors. In May, we did a Speak Volumes ad promoting responsible drinking practices. And then in June, one discussing how drinks add up and not all drinks are created equal. And then continue to place in high traffic areas in the city of Wahpeton, how does your drinking add up with the QRS codes? Lindsay attended a We Care Coalition meeting and shared information on fatal vision impairment goggles and provided information on recommended evidence-based strategies on underage drinking. She participated in a challenge booth at Richland Wilkin Amazing Race, where participants were given a challenge explaining the dangers of drinking and driving, along with how alcohol can affect perception, balance, and equilibrium. She did meet with Science School to begin discussing the social host policy, and then she met with Wahpeton Police Department. Initially, she met with the police chief to discuss the benefits of forensic ID scanners and the possibility of using them at upcoming events, and then subsequently met with the deputy chief of Wahpeton Police Department and trained and educated on how to use the forensic ID scanners at community events. great opportunity, great discussion. Unfortunately, the consensus after the training was that the ID scanners may be too large to use. So we will continue to work to get those scanners into the community. We look at successes and barriers. Certainly our partnerships this quarter with our local college here in town and Wahpeton Police Department, and then barriers continue to be barriers. Lack of enforcement, so staff shortages within local law enforcement agencies, so social acceptance surrounding underage drinking. In our community, there's a lack of understanding that even though alcohol is a legal drug, it is illegal for minors to consume, and there are dangers associated with consumption. Ease of access to alcohol, either at community events or within parents' home. And then I think the biggest barrier right now is staffing changes in time here with Lindsay's departure, kind of navigating this particular project and ensuring that we're meeting our goals. That's all I got.
Perfect. Thank you. All right. And then I've also got, I think finally we have Towner County, and I've got theirs pulled up as well.
All right, thanks. I am Annie Maestrian, and my service area is Towner County. Our priority substance is alcohol, and our local condition is underage drinking. Next slide. So things that we have done. Oh, never mind. On the wrong side. Okay. So in our local condition, we see that we had an increase in students who drive with people that have been drinking. There was an increase, about 54% of students reported drinking within the last 30 days of taking the survey. And there's also been increase in kids getting their alcohol from friends 21 and older. And then our inventive strategy is local media campaign, student prevention, and curriculum. And that is in progress right now. Activities that we have implemented so far. We do Facebook posts, which include parents lead, not so much in my house, not in my house anymore. We do weekly newspaper ads that I make myself. We have media ads on our TV that are in our waiting room. And then we do posters and flyers in 10 different locations, flyers handed out to daycares, hand out brochures whenever we get a chance to. We also have 2 banners in the school gym, and I'm going to expand some banners to hopefully the baseball, football field, because they're right next to each other, and then the hockey rink in town. This year we did multiple sticker shocks during the school year, and that was to help we had students going to Europe for a music tour, so they were trying to help raise money, so they did some sticker shock campaigns for us. And then I also did a promotion and implementation of an alternative event, which was the after prom party this year. And that had a really good turnout. I think we had, off the top of my head, I think we had about 65 attendees. And then I think only 1 student did not show up. And then there was no minors given out that night, and then there was no known parties also that night. So that was great. We did hear some backlash though, because we did have a drawing that the kids could take a breathalyzer, and they could get into this drawing for certain prizes or whatever, and so it was not required. Well, we got some people, one particular in the community, a male member, that thought it was the kids' right to not have to do that, and how dare us breathalyze these students. And it was kind of a big ordeal that he was going around. And of course he works in our local alcohol liquor store, but didn't have much to think about him because he also is a 40-year-old that lives with his parents still. So we just kind of took it with a grain of salt with that one. But otherwise, this is our 3rd year of doing that, and we haven't had any backlash before just now. So So building capacity, I do monthly webinars to try and keep up with education. And then we also do, oh, that didn't change. I meant to change the monthly Q&A meetings that we have with each other. All right, next slide. So currently I am looking at finding an evidence-based curriculum on that Blueprint website, which I found that they are no longer, as of July 1st, they are no longer updating their website because they have no more funding towards that. So that's kind of disappointing because that was a good resource for curriculum. But I did find one that it's kind of a lifestyle training for kids 7th through 8th grade. And that's kind of where my problem area started with students too, is that's when they started drinking. So I think I'm going to get that established and training will be started for me. I think it was end of August. So that's it for that. And then barriers, we've just, we haven't been able to do a whole lot this summer because all of us have young kids, and who knew that a 6-year-old would have so many activities this summer. But so yeah, that's been about it. Once school starts, we'll be going full force again. So that's about it for Towner County.
Awesome. Thank you, Annie.